This video is about how to manage ordering around truly critical events in the emergency department. Here's the basic rubric, which is if there's a code blue occurring and your order is given as related to that, then we're not asking people to mess with computerized order entry in that setting. The patient care is just too critical there. And then another item is that the medication administration is being documented right off the sheet. The nurses don't need to have a computerized order against which to document. In more or less urgent, but still serious or more elective settings, then we're asking providers to place computerized orders either before the procedure if possible, or if necessary afterwards. And here are examples of how that could work. Let's pick intubation as an example. So let's type in intubation. Here we go. ED procedure set. So you know that we have other procedure sets on the list as well. Let's look at that. It's set up as something that you would order in anticipation of doing the intubation in the future. These will go to the nurse's tracker, and the clerical specialist will see it and be contacting respiratory. This will also give you a way to order normal saline. And if you know what drugs you're going to be using, you can for induction, you can certainly order those here. Etomidate and Sux. Click on those items. These are post-intubation meds, so if you know for sure you're going to be doing that, you can order some propofol. And similarly, we have a chest x-ray that will be done after the procedure and a blood gas. So if you're doing all this ahead of time, you can just go ahead and click on those things and file them. Let's say, though, that a patient has come in truly critical. You intubated on the fly. You got everything done. You were giving verbal orders for administration of drugs from the RSI kit. Don't need to be after the fact placing nursing orders, but it is important to have medication orders that the nurse can document administration from. So let's say that you use here etomidate and Sux. So click on those, and you notice the 0 milligrams. You don't have to worry about filling those in because the nurse will be able to still match the orders against this, to sign off against this order. So it will work for documentation purposes, and you don't have to remember exactly what happened there. Again, here's an opportunity to order the post-intubation sedatives and chest x-ray if that hasn't already been ordered in the blood gas. You can order initial ventilator setup from this screen as well, with mode, FiO2, rate, tidal volume, all that. If you don't do that, then somebody will figure that out. That's okay, but here's an opportunity to place those orders as well if you'd like.